Welcome back to Central Valley Talk, where we celebrate what's good about Fresno, what's good about the entire Central Valley. Thanks to all the viewers we're getting from Stockton and Merced and Modesto, all the way down to Porterville, Visalia, Exeter. We've just grown and grown and grown. By the way, we're on our 14th year. We're going to have our 15th anniversary pretty soon. But a big thing's going to happen here at Central Valley Talk. We're going to get our 1 millionth view on Yahoo, YouTube, on YouTube, 1 millionth view. I think before this year's over, we'll get our millionth view. So we've been working really hard for that. All of our best videos are there. You can go look at old interviews, and you want to know about a subject, you can find out about that subject right there on our YouTube. The videos stay there forever. I've been trying to find out some answers. I'm not big on taking medications and medicine all the time. My doctor's always trying to get me to do something, and I resist it. I've asked an expert in to talk about some things like acne and sculpting and things like that. Dr. Najeeb Chaudhry. I did pretty good on the name.
Yes.
Dr. Najeeb Chaudhry. Now, medicine doesn't always have to be the answer to everything. We were talking earlier before we came on there about acne, for example.
Correct.
First thing they seem to do is prescribe medicine for that, but you have another way.
Yes. So, Layden, the most recent research done on this acne clearance is AviClear. AviClear is a new machine that's been cleared by FDA to be used as a laser to help people treat their acne. It's 90% or more effective. People that I've used it on so far have loved it.
No medicine.
No medicine.
Because medicine, I mean, it could affect your kidneys or your liver or different organs.
Correct. So that's one of the major differences. No lab values, no downtown. Most people that get treated, and which is fine, most dermatologists will treat them with a medicine that has to make sure you check lab values for your kidneys and liver, and most likely you can't get pregnant and all those things.
A lot of things when you're on the medication.
Yeah. So, but this one, no lab values, nothing. It's easy. 3 sessions recommended.
It's called AviClear.
AviClear is a machine through Cutera is a manufacturer.
It's some kind of laser.
It's a laser, but the nice thing about the laser is it doesn't burn.
You don't feel it, huh?
You can feel a little bit depending on the cyst ones, but in most general you don't feel it because the end of it is cooled down to 2 degrees Celsius.
Wow.
So that's why you don't feel the laser going through you. But it's a nice...
Americans don't know what Celsius is, by the way.
Well, it's cooler than Fahrenheit, so 2 degrees Celsius means it's relatively cool.
Almost
and keeps
freezing,
almost keeps your skin relatively cool, and you feel the coolness, and so that way you don't feel the laser effect on it, pretty much. But it is a nice, successful, well-tried. You can see it if you look AviClear on YouTube, you Google it, fancy people all the way from Beverly Hills across the U.S. It's something that now they're trying because people don't have to have the medicines as well as don't have to worry about most of the side effects.
That is great, Najeeb, that there's an option now.
Yeah.
Medicine is wonderful in the 2000s or 2020s because there's options to just taking pills and medication.
Correct.
But there's always some sort of a backlash on it. AviClear, if you have acne, if your kid has acne and you're watching this, give this to them as a Christmas present.
Yep.
Go see Dr. Najeeb Chaudhry and ask him about AviClear to treat the acne on the face, about anywhere you get acne.
Yes. A majority is face, but you get kids have a face and back. That's where I see it most.
Now, one thing I keep asking Dr. Chaudhry about is my stomach. I go to the gym all the time. And I'm working out. People try to sell me diet pills and take this pill. I don't want to take any pills or medications if I don't have to. But there's an option.
Yeah, so, with all the technology advances, now we have 2 machines in our office. One is called TrueSculpt ID, which is just for burning the fat. And it helps to, with one session, 24% reduction in your fat.
One session, 24%?
Yeah. So the idea is, you come in. TrueSculpt will help make sure we assess where you need the most, because sometimes most of us have rolls or lumps and we're trying to treat that. It's a 15 to 20 minute session, but 15-minute session overall, but TrueSculpt ID is just to burn the fat.
What is it doing? Is it freezing?
No, it's burning.
Burning.
Because it's a heat.
You're going to feel the heat?
You're going to feel the heat. You're going to have red mark. That'll go away in short time. but it is heat. It is not cool sculpting, which is another method.
Right.
Works for some people, but we're actually just doing heat, and that's this one.
Yeah, I see these places. Dr. Chaudhry is a medical doctor. You know, he's not like a technician that's going to do something. It's an MD here, and that's the kind of person I trust when I say, what kind of thing you're going to do to get rid of this fat.
Exactly.
And he says, Mike, don't get the knife, don't get the pills.
Yeah.
Let's do this medically non-invasive.
Non-invasive, meaning there's no downtime, there's no surgery, nothing. So after you're done, you can go about your business.
Yeah.
So
now there's two. There's here True Sculpt, and then there's this M Sculpt.
Yeah. So the only difference between them, they both do fat reduction, but the EM Sculpt Neo specifically also at the same time does two things at once. It's reducing the fat with the heat again, but it's building your muscle. Wow. That's a major difference. So it's 2-in-1 on the Neo Sculpt versus just True Sculpt ID is just reduction in fat.
Yeah. So this M Sculpt helps with the muscle.
It builds the muscle.
I tell you, I'm going to the gym almost every single day. I'm interested in the muscle. I'm trying to get rid of the fat layer. Yeah. There might be muscle under there. I don't know.
Yeah, and we have them. It's just, men, the most common place for men to put fat is our stomach. Whereas the ladies can have various other spots. We tend to just do the stomach.
But you have the True Sculpt and the M Sculpt there. Two different companies.
Two different companies, two different machines, and we see based on the patient's need which one is better for them. Yeah. That's how it works.
Well, consult a medical doctor. That's what I keep saying. Which is this that we're seeing up there?
Yeah. So this is the AviClear and the True Sculpt ID.
Okay.
And then later he'll have the other picture where it's for the Neo, and the last one for people as they age. One of the things for most ladies that have kids and stuff is pelvic weakness.
Yeah.
And pelvic weakness occurs for men and women, and so BTL Emcella is really for urinary incontinence. Is what's improved. So this picture right now is the EMS Sculpt. Neo Sculpt.
Okay.
And it's got a paddle. Like I said, it does 2-in-1, reduce the fat and the muscle buildup. And the last one we'll talk about in a few minutes is just BTL Emcella. This is for anybody that's got urinary incontinence and urgency. There's that machine. And basically it also...
This is the Emcella?
This is part of the Emcella, yeah. And so idea is it helps to strengthen the pelvic muscles, the pelvic floor of the muscle. So you don't have as much... urgency incontinence, up to 90% effective once again.
My goodness.
So people that have issues, all of these items are aesthetic, so most 99.9% of insurance do not pay for it. I have to be upfront about that. Yeah. It is all cash because it's aesthetics, meaning insurance companies do not feel that you'll die without it.
Right. Well, let's come back to us, and I'm going to ask you about this incontinence one. You know why I don't know anybody who has it? Because people don't talk about it. A lot of people have it, right?
Majority of us will get it sooner or later, men and women. It is one of the most common reasons you go see your urologist.
And people don't talk about it. So
no,
we don't think it's a big problem out there. It's a taboo.
Yes, taboo. Yeah. And as the times changes, still again they're managing medically. We're just giving them options where it's not medicine needed, no lab values. No downtime because we're not doing any surgeries. It's not invasive, and they can get up and go about their business.
And again, the incontinence is from weakness of muscles.
Pelvic muscles, yes.
Pelvic muscles.
Yeah.
And this device or machine or whatever...
It will strengthen because of the way it works.
Okay.
And
strengthen the muscle,
Yeah, and I always tell my patients, and we're doing consultations, if you want to come by and see us, set up appointment. Our number is 559-277-3909. Set up appointment. We'll demonstrate it so you can feel it firsthand, 5-10 minute demonstration, so they can feel all the machines, whatever they need.
Right.
So we can, as they say, pictures are worth 1,000 words. So machines that are doing the work, then you feel it, then you say yes or no.
Oh, nice. Come in and try it. Now, on the incontinence issue, how many treatments? How long?
They usually recommend 6 treatments, so 2 treatments a week for 3 weeks.
3 weeks.
That's it.
Forever?
It may not need it for another whole year, 6 months, a year. Yeah. So if they have something that's still not working, we can try it. But a lot of that. That's why we're not in competition with the urologist or any of these people. We're working as a team. So this is another avenue that for people that don't want to always take, like you said, medicine and stuff. Work about that. So and worry about the labs and all the effects.
Right.
So we give this, and this much more safer in the overall long run.
I believe that. Now, for the incontinent, now your insurance doesn't cover this. Like I said, this isn't a life or death thing, so you're not going to get insurance company. And I don't want to talk to you about prices on our show here, but it's not $1 million. It's in the range that people can afford.
Correct.
And of all the things I would spend my money on, if I'm incontinent, that's what I'm going to spend the money on.
And think about how many. As somebody told me the other day, who are the most people that have incontinence? Elderly.
Right.
Elderly, and they're the ones that have Medicare, don't have a lot of cash.
Right.
And so we do have alternative financing and all those available, but pricing is something, that's why we do the consultation.
Yeah.
So depending on the need of the person and the patient, then we can talk about the pricing.
Very good.
So
now, I got a lot. I'm 63. I got a lot to look forward to, right?
Yep.
Incontinence. And things
it's
like
not
that.
one of them, right?
I mean, these things just happen. They're going to happen.
Yeah.
They're coming. They're on their way. So somebody watching this right now may say, I don't need that. I don't need. Maybe in a year or two, you'll remember this interview with Dr. Najeeb Chaudhry and go back to YouTube and find him and watch this video. That's a lot to cover.
Yeah, I appreciate your time, Mike. It's nice to be back.
You call this mostly aesthetic things.
Yeah, it's all aesthetic, meaning it's something to change the body, whether it's a look, acne or whatever, or the contouring of the shape of the body, because it's superficial. It's nothing.
Now, people our age, I'm getting heart issues. I got to take the blood pressure medication, but none of this affects the heart. And
correct.
And it's just,
so if somebody and one of the reasons we do consultation is, there are certain things that you cannot have. Like you can't have a pacemaker. We won't do it on somebody has pacemaker because it's all radio frequencies and stuff like that. Yeah. So there are contraindications, but that's one of the things why we have consultation. People come in, we talk about it, and then we say, are you a candidate or not?
Right.
So, but to remind people, we're located at KMY Prosthetic Orthotics. Is located at 6137 North Thesta Street, Suite 101B, Fresno, California. Our email is kmyopc@gmail.com. Phone number is 559-277-3909, and fax is 559-277-3090.
Now, where is that corner near?
So the major streets south of Highway 41, Bullard Street exit, and Fresno.
Oh, yeah. So you
Bullard
get on the 41, get off at Bullard, and you are there.
Yeah.
By the way, that's a lot of information. I'll tell you, our viewers, if you didn't get this down, call me. I'm going to keep this on my desk. The phone number, the address, a link to our video that you can watch again. If you don't have the information and you want it, or for someone else, call me. I'll put you right in touch with Dr. Chaudhry. Thank you, sir.
I appreciate it,
You
Mike.
brought us very important information.
I appreciate
it very much. We'll be back with more Central Valley Talk with Mike Grace.